Hello, welcome,
Hi.
welcome again, Dr. Mintz. We've never done a live together. We have done a webinar and we've spoken several times. I'm just going to briefly introduce you. Um, Laurie Mintz, Dr. Laurie Mintz, a sexual psychologist, professor, and author of Becoming Cliterate. For those of you who do not yet have this book, please do order it. I've had the pleasure, as I mentioned, of learning from and speaking with Dr. Min several times now. And you can find our last conversation over on our YouTube channel, Alloy Women's Health, for more. For today's talk, we'll be diving into a conversation about something essential yet often overlooked, the role of pleasure in women's overall well-being, especially during perimenopause and menopause. That this stage of life comes with hormonal shifts that can impact our sexual health and desire is critical, but it's also a time to redefine what sexual pleasure means for us. So welcome again, Dr. Mintz. Just to get us started, I'm curious to know from you the biggest mistake people make when it comes to thinking about sexual pleasure in midlife.
The biggest mistake people make is the idea that it's over,
Mm,
that it is something of the past, that sex drive is something of the past, that orgasm is something of the past. And none of that is true. You might have to do it all differently, but I think that is the biggest mistake because, as someone just said, you can orgasm forever. Yes.
right.
Yeah. Yes.
Right. Thank you for that. Thank you for that. We're going to dive into much of what you just brought up in a moment. But as it relates to hormones, hormones undeniably impact our sexual health and often our desire. And while your work doesn't necessarily specifically sort of shine the light on hormones all the time, how do you see hormonal changes impacting or affecting a woman's ability to enjoy sex?
Well, my work doesn't talk about it, but my personal life
Yes,
can, if
I
you
know.
know.
Oh, yes, you shared that with us, and feel free
I,
to again.
yeah. So, and I am not, let me just caveat this. I'm not a physician. I am a psychologist and a sex therapist, but I certainly have read enough about hormones, have gone to medical conferences. So nobody should take what I'm saying as medical advice. You should see your doctor, and honestly, not just your doctor. You should see maybe
A
somebody at
menopause
my Alloy,
specialist. Yeah.
at a menopause specialist or a sexual medicine specialist. And I think my Alloy has all of those.
Yes.
So hormones, the best way this was described to me was by my own gynecologist, who said, we outlive our hormones. We outlive what we used to die before we hit menopause. But now when we hit menopause, all our estrogen decreases, first of all. And estrogen is responsible for a lot of things: sleep, skin health, and vaginal health. So without estrogen, what happens is the vaginal tissue thins. And when that vaginal tissue is thin, a lot of things can happen: painful penetration, UTIs. Um, in fact, I'm going to really go for it. I literally just raced back here from the doctor because I was diagnosed with another health issue. They took me off hormones. I got a UTI right
Yeah.
away. And I
Yeah.
just
Oh,
went
I'm sorry.
to, it's okay. I'm going back on them. I said it's worth it because, I got diagnosed with this heart thing. They were like, no more hormones. And I said, I got a UTI within a day or two of going off. They're
The-
like, go back on them.
yeah, and
The
also vaginal estrogen,
It
which
doesn't cut it for me.
it wasn't doing enough for
Yeah.
you.
So
Okay, you needed
you
systemic.
so basically, here's the deal. You can take estrogen vaginally or systemically or both. If you have a uterus, you cannot take um, estrogen systemically without also taking
Right.
progesterone. So because and all those things go down, and testosterone also decreases. And now testosterone has a relationship to our sex drive. And so that's often prescribed as well, off label. But I will tell you that, it depends how menopause hits you,
Right.
right? But for many women I know, including myself, dry, painful vagina, UTIs, painful intercourse, all of that, lack of sleep, that's
Right.
related to the progesterone. So hormones are really related to our vaginal and overall health. Now, not everyone can have them, right? Certain people with cancer histories, but even that, you can do vaginal according to some doctors. So
Yeah.
see a doctor at Myalloy, because
Thanks,
like
Dr. Mintz.
yeah, yes, Hilda's saying lack of flexibility. There's so many problems. We need our
So
hormones.
we do need our hormones, and certainly not to put you on the spot about the hormone conversation, but I am thinking about people you've had occasion to have conversation with in perimenopause and menopause who are impacted by hormones as it relates specifically to their sexual well-being. And I want to sort of thread the needle with so much of what you talk about, which is sort of expanding the definition of sex beyond penetration. Can you
Yeah,
talk about that?
100%. So, why am
I
I
think because you gave your screen a thumbs up. It's so
that's
funny.
fun.
It
It's kind of
happens.
like an orgasm,
It's really funny.
huh? See, I'm going to
it's
talk
ve-
about sex. Here we go.
it's very you.
Yeah, so the bottom line is that I have spoken to many women, many who don't know that this is menopause, right? They'll they'll come to me and they'll say, suddenly penetration is painful. And I'll say, are you perimenopausal or menopausal? Go see a doctor. But the bottom line is we don't need penetration. Let's talk about penetration, okay? I am not saying penetration doesn't feel good for some women. A lot of times it's painful even before perimenopause, right? But what we know is that the vulva, I should have grabbed my vulva puppet. Ah,
That's okay. That's okay. You can check out our webinar for that. Yeah.
okay, so the vulva is the outside area, and it includes the clitoral hood, the glands, the inner labia. And what do we know? We know that, depending on the way the question is worded, 96% ever 18 I'm sorry, 4 to 18% of women can orgasm with just penetration. The rest of us need external stimulation, vulva clitoral stimulation, and that is our main source of pleasure, of orgasms. So I have a lot of my work is dedicated to vulva awareness and language. Like, why do we use the word sex and intercourse as if they're the same, when for us external stimulation is where it's at? We need to consider external stimulation just as much sex as penetration. And also, as we go into perimenopause, sometimes for some women, you need extra stimulation there. What used to get you there, maybe it was hands. Now you need a vibrator. Maybe you had a vibrator. Now you need a stronger vibrator. No, so really, sex is much more than just putting a penis in a vagina, especially for women, especially for perimenopausal and menopausal women.
Great. Thank you for that, Dr. Mintz. I'm thinking about conversations I had over the course of last month, um, which spoke to communication. And so many of us in perimenopause and menopause have maybe been by this point in long-term relationships. And having a conversation for some can get dicey. Um, can you talk about sort of how women can improve their communication with their partner during this time and have their needs met or
Oh,
explored?
yeah, we know from the research that couples who communicate about sex have better sex. I'm fond of saying communication is the bedrock to make your bed rock. And we need to communicate our needs outside of the bedroom, before sex, at the kitchen table, during sex. And by sex, I mean the whole encounter,
Right.
not just penetration. After, how was that? And it's hard. I get it. It's hard. But what I suggest is sitting down and making sure it's a good time, making sure there's space, and using meta communication, which is communication about communication, and then I statements. Let me role model this.
Yeah.
I want to talk to you about our sex life. I'm super nervous to do this because I don't want you to get defensive or think I'm complaining. I love you. I love our sex life, but I want to talk to you about things that can make it better for me, especially as my body is changing with menopause. So I attended this IG Live and I found out that a lot of women need extra lubrication, store-bought lube, vibrators, more external stimulation during menopause to experience orgasm. And I want to have orgasms with you. I'm not going to have them during penetration. That's just not the way my body works. But I want to make sure that I can get the stimulation I need. How does that sound to you? So meta communication, I statement, etc. Really, and then during sex, here's some, you can tell your partner what you want, or here's what I strongly recommend. It is, I cannot say this enough. It is no less sex if you do it yourself while the partner is there. Meaning, maybe he's caressing your breast while you're using a vibrator. Maybe you're using a vibrator during intercourse. We know where our body is, and it changes week to week, moment to moment. He's still, or she is still, part of the equation. So,
Okay, thank you. That's so helpful. You brought up lubrication, and I know you talk about this a lot. Can you let us know the best lube to be looking for, what we should be using?
well,
And it's not vaginal estrogen. I want to clarify that. Lubrication and vaginal estrogen are two different things,
yeah,
and everyone should be using vaginal estrogen. But tell us about
yeah.
lube.
And there's also vaginal estrogen. There's also moisturizers, which are also different. There's something that you put in a couple times a week. And then there's lube. And lube is, it comes in water-based, it comes in silicone, it comes in hybrid, which is a combination. And lube does a couple things. Vulvas are not um, supposed to be touch dry, and vaginas are not supposed to be penetrated without lube. So a lot of women will take lube, apply it on the outside, and we have this association. Oh, I'm wet. I must be excited, which helps with the mental piece of it. Sometimes you can take a little medicine syringe, put it on inside, put it on your partner's penis. It makes everything go better. And a lot of times, silicone lube is the best for penetrative sex because it's longer lasting, slippery. But a lot of people say, "Oh no, don't use silicone lube with silicone sex toys." I call I call BS on that.
Okay.
Ruin your sex toy if you want and buy a new
Okay.
one, okay?
Okay. There's your solution. Yes,
Or
absolutely.
spot test it. You take a
Okay.
little of the lube on the sex toy and see, does it get tacky, change colors. And often medical grade silicone vibrators are not going to deteriorate. But lube, vibrators, everybody should have a drawer full of vibrators and a cabinet full of lube.
I, thank you. I love that. Um, Dr. Mintz, you've written so much in your book about the importance of mindfulness in experiencing sexual pleasure. For those who haven't yet read your book, how can mindfulness be particularly useful?
Okay, so mindfulness is when our mind and our body are in the same place, right? So many times our mind is brilliant. It can go forward, it can go backwards, but so many times it's not right where we are. Like I challenge every listener. We've been on 16 minutes. If your mind wandered 20 times, oh, should I eat lunch when I'm done or at 1 o'clock? Or maybe I should call my doctor today. It's completely normal, but we need to practice putting our mind and body in the same place. And mindfulness is the way to do it. You can do it through meditation, or a lot of times I say the next time you're brushing your teeth, just really focus on the sensations in your mouth. When your mind wanders, bring it back, use breath. Because here's what we know, you cannot have an orgasm. Absolutely, when your mind is somewhere besides the sensations of your body. And you have to be focused on your sensations, and that's what mindfulness teaches us to do. And here's something else that I haven't written a lot about, but I've been thinking about that goes along with this. The best sex, basically, with two partners involves a moment or two, or three or four, for each of them where they are fully in their own bodies, not thinking about the other person. And those are the moments before and during orgasm. You can't orgasm if you're thinking, is he or she having a good time? Orgasm is a total internal focus. And that's, you need to be able to do that to orgasm.
That's so helpful, and thank you for that. And a very favorite person of mine is watching us, and she has brought up a few times how important sort of the mind body connection is to her sexual pleasure.
I'm sorry, you cut out a
That's
second.
okay. That's okay. I'm just commenting that there's someone on this call who's a favorite person of mine who's talking about the importance of, or sort of her own personal recognition that the mind component is so important to what's happening physically. But what you just said also makes me think of what you've been talking about on your feed lately a lot, which is the orgasm gap. Can you talk to us about that? And yeah,
Absolutely.
the work, I think there was a journal, there was a study or something that you talked
Yeah.
about, but I can't remember the name
Yes.
of.
So the orgasm gap is the consistent finding in the scientific literature that when cisgender women and cisgender men get it on, the women are having fewer orgasms. This has cut across 30 years of research. 30 years. And this is why I wrote Becoming Cliterate, to sort of bring awareness to this and close the orgasm gap. And a recent review paper came out that reviewed all 30 years of this research, and it concluded that in all situations where women are having fewer orgasms, that includes hookup sex, that includes sex with men, compared to the ones where they're getting more clitoral stimulation. It's all about clitoral stimulation, basically. Let me take a step back. This review paper said the orgasm gap is not biological, it's cultural. And the orgasm gap is the biggest in situations where women aren't getting clitoral stimulation. And it's like that's with sex with men, it's in hookups, but we know women get more with other women, often in longer term relationships. So the orgasm gap is not about our bodies. When women pleasure themselves, 95% reach orgasm in 4 minutes easily.
Wow.
I mean,
Okay.
we know what works for us, but we often don't translate that to partner sex, especially heterosexual partner sex. We
Interesting. And go ahead. I'm sorry.
no, that's it. Yeah.
I obviously I'm thinking also about women in midlife, perimenopausal women, menopausal women, and just how much more sort of um, research is lost there. And go ahead.
No, most of the orgasm gap studies were done with college
Right.
students, younger adults. but there was actually a new paper that just came out, and it came out, it's not in this review paper. I think I posted about this as well. They looked at the orgasm gap across ages, and what they found is it exists still
Wow. Yeah.
across ages.
Yeah.
It doesn't get better with age. For some women, sure, we get to be more comfortable with our bodies, communicating, but the orgasm gap exists across life
Well,
stages.
and that's really what your work is about and why it's so compelling, I think, for me and, women in this community, in this menopausal space, if you will, because um, it, you're you're continuing to remind us about how to get our needs met, especially if our libido may be in the tank. Were you about to say something? I'm
No,
sorry.
go ahead.
Okay. There's like a weird delay in our
Yeah,
conversation. I'm sorry about that.
that's
Um,
okay.
so self-care and pleasure is something you also conflate often. How do you suggest that women in this space approach self-care practices that will enhance their overall sexual well-being?
You know, first of all, the mental state. Pleasure is not frivolous. It is not frivolous. We know that pleasure in general and sexual pleasure specifically is related to sexual satisfaction, and sexual satisfaction is related to life satisfaction. So, self care, including sexual self care, is life affirming. So, take the time. That might mean masturbating. It might mean having encounters with your partner. It might mean taking a walk in nature. Might mean going to yoga. And here's something really interesting. There was a study. Now, it wasn't premenopausal women, but I think it still would be found in perimenopausal and menopausal women. Women who do yoga have more orgasms.
What?
Yeah.
Really?
Yes, and I do yoga a lot, and I think I know why.
Okay.
It's because it teaches you that mindful body focus. It's a
Amazing.
yeah. So take up yoga, walk in nature, feel your feet on the ground, watch a movie, read a book, incorporate pleasure into your life.
Thank you for that, Dr. Min. So, I'm just thinking about sort of like one thing a woman can start to do today that will help her sort of bridge that gap between, a libido that feels kind of wobbly, a busy life, a desire to have a more stimulating, satisfying sex life. What do you think?
Yeah. Okay. Before I answer that, is it okay if I say something about desire real fast?
Please, yes.
Okay. So when we think about desire, we think about, ooh, I'm horny, right? And that is one type of desire. It's called spontaneous desire. It's often something of our youth. And basically, there is a different kind of desire. It's called responsive desire. And it's like, oh, I want to have sex because I know it'll be fun when it gets going. I know I'll feel closer to my partner. I'll know I'll sleep better. It's up here. And you can feel that without feeling anything in your genitals. No
Right.
tingling, no horniness. So, an empirically supported technique at this age is to use responsive desire to schedule sexual encounters, to let your it's reverse the equation. Don't wait to be horny to have a sexual encounter. Have a sexual encounter to get horny. And during that encounter, use mindfulness, use lube, use a vibrator. Take your time. Make sure you're getting the touch you need.
Awesome. Thank you. Is there anything else you'd want to say to this group? I know that's a big question to throw at you, but for those of us in this space that you might want
Yeah.
us kind of leave us with.
What I want to leave you with is a study. by a wonderful woman named Peggy Kleinpatz. She wrote a book called Magnificent Sex, but I'm gonna break it. Go buy it if you want. But I'm going to break it down for you in one sentence. She studied people who were having magnificent sex instead of studying people who were having bad sex, right? And guess what she found? What she found is that for women, they said their best sex started at age 50.
What? Really? Is everybody listening? That's interesting.
And so you can have magnificent sex now. It's not going to be like when you were 18 and you were suddenly horny and didn't need lubricant or, but you can have magnificent sex now if you have the right medical treatment. See a doctor at Alloy. When you have the right tools, vibrators, lube, when you take your time, when you prioritize your pleasure. So what I want to leave you with is magnificent sex can start now.
Okay, I'm laughing because I gasped and everybody else did too, and it's so funny because obviously there we know we can, but there's like a what? I didn't realize that. So you're letting us know sort of like um to that study what should be in the room with us in order to have you know great sex. But was there anything in the study mentioned about what it is about being 50 or about being in midlife that turned the dial up on sex?
Yeah, part of it's getting comfortable with our body, being able to communicate, and part of it is being creative and not focusing everything on penetration.
All of
So,
your work.
yes,
Yeah.
surprise, surprise, right?
Yeah. Fantastic. Dr. Mintz, I always love speaking with you and seeing you. It's such a pleasure every time. Thank you for all of your work, your education, your advocacy, and thank you for this
And I
conversation.
always love being in space with you, personal, over the phone, whatever. So thank you for all you do.
Thank you so much. And
Okay.
thanks to everybody who came today. Get your lube, get your vaginal estrogen, get
Yep.
out of your mind.
That's great.
Bye,
Okay.
everyone.
Bye.
Bye bye.